A pancreatic pseudocyst is a fluid-filled sac that forms in the abdomen, typically as a complication of pancreatitis, or inflammation of the pancreas. Unlike true cysts, pseudocysts do not have an epithelial lining, but are surrounded by a fibrous or inflammatory wall. These pseudocysts form when pancreatic enzymes and tissue damage cause a collection of fluid and debris. Pseudocysts can vary in size, and while some may resolve on their own, larger or symptomatic pseudocysts require medical or surgical intervention to prevent complications such as infection, rupture, or bleeding. There are two main types of pancreatic pseudocysts, acute and chronic. Acute pseudocysts typically form shortly after an episode of acute pancreatitis, within 4 to 6 weeks, and often follow a sudden, severe attack of inflammation. Chronic pseudocysts, on the other hand, develop over time, usually in individuals with chronic pancreatitis, a long-term inflammation of the pancreas that can lead to scarring and ongoing damage. Both types can cause similar complications, but the management may differ depending on the underlying cause and the patient's overall health condition. The primary causes of pancreatic pseudocysts are acute or chronic pancreatitis. Acute pancreatitis is often linked to gallstones or excessive alcohol consumption, while chronic pancreatitis is more commonly associated with long-term alcohol abuse, hereditary conditions, or repeated episodes of pancreatic inflammation. Trauma to the abdomen, such as from an accident or surgery, can also result in pseudocyst formation. In rare cases, pancreatic pseudocysts can form without any known trigger, but they are most commonly tied to pancreatic diseases. Several risk factors contribute to the likelihood of developing pancreatic pseudocysts. These include a history of pancreatitis, heavy alcohol use, gallstone disease, abdominal trauma, and certain genetic predispositions. People with chronic pancreatitis are at higher risk of developing pseudocysts due to ongoing damage and inflammation of the pancreatic tissue. Additionally, individuals with poorly managed gallbladder issues, or those who consume large amounts of alcohol are more susceptible to conditions that could lead to pseudocyst formation. Symptoms of a pancreatic pseudocyst can vary depending on its size and location, as well as whether complications arise. Common symptoms include abdominal pain, nausea, vomiting, bloating, and a palpable mass in the abdomen. If the pseudocyst becomes infected or ruptures, symptoms can worsen dramatically, leading to fever, severe pain, and signs of internal bleeding. Larger pseudocysts may compress nearby organs, causing jaundice or difficulties with digestion and bowel movements. Treatment options for pancreatic pseudocysts depend on the size and severity of the cyst, as well as the patient's symptoms. Small, asymptomatic pseudocysts may not require immediate treatment and can be monitored through imaging studies. If the pseudocyst causes symptoms or complications, drainage is usually required. This can be achieved through endoscopic, percutaneous, or surgical methods. Endoscopic drainage involves the insertion of a stent to drain the fluid into the stomach or intestines, while percutaneous drainage uses a catheter inserted through the skin to remove the fluid. Surgical drainage may be necessary for large or complicated pseudocysts and involves creating a direct connection between the pseudocyst and the digestive tract. When it comes to surgical management, procedures such as cystogastrostomy, cystojejunostomy, or cystoduodenostomy are common approaches. These surgeries involve creating a permanent connection between the pseudocyst and the stomach, jejunum, or duodenum to allow the cyst to drain internally. Surgery may be necessary if the pseudocyst is very large, causing significant symptoms, or if other methods of drainage fail. In cases where the pseudocyst is infected or poses a risk of rupture, more aggressive surgical intervention may be required to prevent life-threatening complications. Nursing care for patients with pancreatic pseudocysts focuses on monitoring for signs of infection, managing pain, and providing post-operative care following drainage procedures or surgery. Nurses play a critical role in educating patients on the importance of avoiding alcohol, which can exacerbate pancreatitis and lead to further complications. Nutrition management is also vital, as patients may need to follow a low-fat diet to reduce the workload on the pancreas. Pain control, monitoring for complications such as infection or bleeding, and emotional support are key components of the nursing care plan. Subscribe us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.